We are going to discuss the histology slide of the placenta, particularly the identification points, how to identify the slide of the placenta during the practical examination. We will see this slide under the different magnification 4x, 10x as well as in the 40x lens. Okay, so first we are starting with the 4x. So this is the microscopic image taken under the 4x lens. Okay, now in this image you can identify the villi. Now in this slide you can see the various sizes of the chorionic villi are there. Okay, you can see this one, this is the second, third, and this one is the fourth. They are somewhat much bigger in the size, okay, and this is the smaller size chorionic villi are there. So this major size, bigger size chorionic villi, they are ultimately the stem villi branch. Now within this stem villi branch, okay, you can see the fetal blood vessel. Okay, in the center here you can see this is the fetal blood vessel that is containing the fetal blood. Now surrounding this fetal blood vessel you can also see this area surrounding the fetal blood vessel, that is the extra embryonic somatopluric mesoderm. Still outer to this mesodermal area, the peripheral aspect of this chorionic villi, that is lined by the trophoblastic cell layer. Okay, and now in between this chorionic villi there is a space that is known as the intervillous space, which is containing the maternal blood. So this is the image under the 4x. Okay, next one, that is the image under the 10x, the slight bigger view. Again you can see the single stem villi is here containing the fetal blood vessels. Okay, within that fetal blood vessel you will find the blood. Okay, so that is the fetal blood vessel. After that you can see the connective tissue here, that is the extra embryonic somatopluric mesodermal connective tissue, and onto the outer aspect you will find the trophoblastic layer. Okay, so that is the image under the 10x. After that we will see this image under the 4x. Okay, now you can see this is the peripheral margin of this chorionic villi. You will see the dark line cells. Okay, there is aggregation of the dark line lining cells, and that is now termed as the syncytiotropoblast. Okay, still inner to that you will find the extra embryonic somatopluric mesoderm, and in between the villi you will find the maternal blood in the intervillous space. Now something regarding the syncytiotropoblast, you will find the clusters of the syncytiotropoblast at the peripheral aspect of the chorionic villi, that is also termed as the syncytial knot. Okay, the aggregation of the syncytiotropoblast, that is known as the syncytial knot, and that is the characteristic of the mature placenta. Now the cytotrophoblasts, they are pale staining cells, so they are found inside of this syncytio onto the inner aspect, onto the inner aspect of this syncytiotropoblast layer, but you cannot differentiate the cytotrophoblast from the connective tissue. Okay, you will find the small few numbers of these cytotrophoblast here inside of this syncytotrophoblast layer, but you cannot differentiate from this connective tissue. Okay, next one, this is the image of the Decidia basalis. This much portion is of the Decidia basalis. Before you go for the explanation, okay, you must clear your concept regarding the Decidia basalis, paritalis, as well as the capsularis, that is the embryological concept. So this is the Decidia basalis, okay? And this region is the of chorionic villi of the chorionic plate. Now this is the incomplete septa that is sent towards the chorionic plate from the Decidia basalis. Okay? So this is the image of the Decidia basalis under the forex lens. Now we are moving towards the 10x. In this image, sorry, under the forex, you can see within the Decidia basalis, this is the blood vessel, maternal blood vessel containing the maternal blood, and this is the chorionic villi of the chorionic plate, and this one is the Decidia basalis, which contains the maternal blood vessel. Next one, that is the 10x magnification. In this you can see this is the Decidia basalis portion. Okay, this is the maternal blood vessel containing the maternal blood. Again, this is the maternal blood vessel containing the maternal blood, and above you can see this is the portion of the chorionic plate which is having the chorionic villi. Next one, that is the image under the 40x. Okay? This is something looking like the mucoid connective tissue we have already seen in the umbilical cord slides. Okay? So this tissue is something looking like the mucoid connective tissue, but here you will find the polygonal decidual cells. Okay? You can see the nucleuses of the cells, polygonal decidual cells, that is purple in color, as well as the nucleuses of the fibroblast. Okay, so that is something regarding the identification points of the histology slide of the placenta.